Hello, Mr. Arvin. How are you?
I'm doing well. How about yourself?
Good. I'm Megan. I'm going to be your nurse today. I see that we're taking your vital signs and you filled out our medical history form. Any complaints today?
No complaints.
Okay. I'm going to be doing a head-to-toe physical assessment on you. So I'm going to be doing some palpitation and some percussion and listening to your sounds. Okay?
Sure.
All right. I'm going to wash my hands. Okay. So first, I'm going to be looking at your just overall physical appearance. You're not disheveled. Your grooming is well. You're looking at the symmetry of your face and your head and eyes. All right, everything is symmetric and aligned. Alrighty, so the first thing I'm going to do is I'm going to be palpating your scalp and your head, filling your lobes. So I'm going to come up closer.
Sure.
Alright, so I'm going to palpate your frontal, occipital lobe, parietal lobe. Okay. I'm going to look in your scalp to make sure there's no lesions or scabs. Alright, I'm going to feel your hair, make sure it's not dry or brittle. That could be signs of dehydration. And making sure your scalp just moves freely across the skull. Okay, any problems in the head,
No.
falling of your hair or anything?
Nope.
Okay, good. Alrighty, so now I'm gonna palpate your frontal and maxilla sinus. So if you feel any pressure or any pain, let me know.
Okay.
Any pain?
Nope.
Any pain?
No.
Okay, good. Alrighty, so now I'm gonna have check your range of motion. We're gonna check cranial nerves 5, 7, and 11. Okay. So the first thing I'm gonna do is I'm gonna palpate your mandibular bone. Can you open your mouth? Oh, there was a slightly lock. Can you close? Can you open again? Okay. Can you close? Alrighty. So now I want you to clench your teeth. Smile. Puff out your cheeks. Okay. Perfect. Alrighty. So next thing we're gonna do is we're gonna move on to your eyes. Okay. So I'm gonna first thing is just gonna be looking for symmetry, alignment of your eyes. Make sure there's no discharge, no redness, no swelling, no redness, no swelling. Just making sure there's no yellow, no discoloration. Any problems with your vision?
No.
Wear any glasses or contacts?
No.
Okay. Alright. So now I'm going to test your cranial nerves, looking at 3, 4, and 6. I'm going to test your visual fields.
Okay.
So I'm going to have my finger, and I just want you to follow my finger with just your eyes.
Okay.
Okay, perfect. So now I'm going to check for accommodation. So I'm going to have my finger, I'm going to follow, and I just want you to, once again, just follow my finger with your eyes, okay?
Mm-hmm.
Okay, perfect. Alrighty. Now I'm going to check for pupillar response to make sure they constrict. So I'm going to shine this pen light directly, and you just keep looking straight, okay?
Okay.
And they constrict evenly. Alright. So now I'm going to use my ophthalmoscope and check cranial nerve number 2. So I'm going to move forward, and I'm going to be checking your optic nerve, your retina, your red reflex, and the macula, okay? Okay, optic disc, retina, visualize. All right, the macula. All right. Can you check your opposite eye? Optic nerve, red reflex, macula, optic disc are present. All right. Okay. So now we're gonna move on to your ears. So once again, I'm just gonna inspect, look at the symmetry of your ears, make sure there's no nodules, no obvious draining or lesions or scabs. Any problems with your hearing?
No.
Okay, I'm just gonna feel and palpate for any nodules. Excuse me. Check for your recall. Sorry. Sorry about that. Check behind the ears. No lesions or scabs present. Okay. So now I'm gonna test your hearing for cranial nerve 8, okay? So I'm gonna have you close your ear and I'm gonna do a whisper test, and I just want you to repeat what I say, okay?
My left or doesn't matter.
You're up here.
Okay.
Alright.
1, 2, 3.
Okay, I'm gonna come over. Opposite ear.
1, 2, 3.
Okay, perfect. Alrighty. So now I'm going to perform a test with my tuning fork. It's the Weber and Wine test, and it's basically going to check for air versus bone conduction. So basically what I'm going to do is, I'm going to place it here, and when you hear the vibration stop, you let me know, okay?
Stop. 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 Stop.
Alright, last I'm going to take my otoscope and look into your ears, okay?
Okay.
So I'm going to lift the peanut back and up. Alrighty, looking for any lesions, scabs, any discharge, any redness or swelling, and none is present. Cerebrum is present. I'm going to look further, and I can see the tympanic membrane, and it is gray in color. Alright, lift the opposite ear. Lift the peanut up and back. No lesions, no scabs, no drainage, no redness or swelling. Look further in, tympanic membrane is gray, and it's intact. Alrighty. So, alright. So now I'm going to move on to your nose. Any problems with
No.
any smelling or smells or anything
No.
like that? Okay. Alright. So I'm just going to palpate. Cartilage should be firm to the touch. Alright. And now I'm going to just inspect and take the otoscope and just look inside, okay? Lift your head, tilt your head back for me. Okay. Just looking for any lesions, any scabs, any redness, any drainage. No drainage present. And septum is midline. Alright. Now I'm going to test. Now I'm going to check olfactory nerve number 1. I'm going to have you close your nair, and I'm going to have you smell. What do you smell?
Alcohol.
Okay. Occlude opposite nair.
Alcohol.
Okay. Alright. So now we're going to move on to your mouth. Okay? Alright. So just going to be looking for any signs of cyanosis, any dryness or cracking or peeling of your lips. Your lips look moisturized and healthy. Alright, so now I'm going to take a look inside of your mouth. And I'm basically just going to be looking for any lesions or scabs or anything like that. Can you open for me? I'm going to use my light to assist. Okay. Buccal mucosa, top roof of the mouth is pink. Alrighty. Vasculature present. Alrighty. No obvious cavities. Alrighty. Can you touch your tongue to the roof of your mouth? Alrighty. Ventral surface, vascular present, smooth. No signs of gingivitis. Alrighty. And can I have you stick out your tongue, please? Yeah. Can you say ah? Alright. Uvula is present in midline. Alrighty. And that tests cranial nerves 9, 11, and 12. Okay. Alrighty. So now I'm going to feel your lymph nodes. and move on to the neck portion.
Okay.
Sorry.
It's alright.
So the occipital, the temporal, the mandibular, submental, trachea, anterior cervical, supraclavicular, supraclavicular. Okay, any problems?
No problem.
Okay. Alrighty, so now I'm gonna feel your trachea and check for your thyroid. So I'm just gonna feel, can you swallow? Alrighty, trach is midline. Alright, feel the thyroid. I'm gonna come on the side and I'm just gonna feel you for your thyroid gland. Alright, so I'm gonna take my stethoscope and just make sure there's no noise in those areas. I'm gonna feel for your carotid pulse, one at a time. Alright, so next, you can put your head back down.
Oh.
Alright, so next we're gonna move on. I'm gonna do your posterior thorax. So I'm gonna have you turn like this. Okay. Can you turn a little bit more? Alright, perfect. Okay. So I'm gonna do a general inspection of the back. I'm just gonna lift up your shirt if that's okay.
Yeah.
Make sure there's no lesions or scalps present or anything. I'm going to check for lung expansion. Just gonna put this here. Just breathe normally, about the 10th intercostal rib. Alrighty. So I'm going to place my hands along your back.
Okay.
And as I place my hands along your back, I'm gonna have you say 99, okay?
Okay.
Say 99.
99. 99. 99. 99.
Okay. So now I'm going to percuss along your back, and the dominant sound should be resonance, okay? I'm gonna go in between the intercostal spaces. Any pain?
No pain.
Just checking for any signs of consolidation, okay?
Alright.
Alrighty, so now I'm gonna listen to your lung fills and I'll tell you to take a deep breath as I move along your back, okay?
Okay.
Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay, perfect. Alright, you can turn front and center. Alright, so now I'm going to do your anterior thorax, and I'm going to be looking at your respirations, making sure they're a regular rate and rhythm. Making sure you're not using any accessory muscles or pursed lip breathing, making sure there's still no signs of stenosis. So I'm just going to be looking. I'm going to check for your lung expansion. So I'm going to put my hands here and just breathe normally. Okay. So I'm going to place my hands down here in front of your chest, and I want you to say 99 again, okay?
99. 99.
Is that too cool? I'm sorry.
Yeah, that's
Sorry.
alright. Okay, okay, do it again.
Okay.
99.
Alrighty.
99.
Alrighty. Sorry about that.
No, it's okay.
Alright. So now I'm going to percuss again across
Okay.
the front of your lung fields, okay?
Alright.
now I'm going to palpate for your apex, which is midclavicular line, fifth intercostal space. Alrighty, now I'm gonna listen to your lungs, and then we'll move into the heart sounds, okay?
Okay.
And you just breathe normally. Alrighty, now I want to listen to your heart sounds, and you can just breathe normally, okay? So aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. So I won't do an actual breast exam, but basically in the shower, if you lift up each arm and just palpate around your breast area, if you feel any nodules on each side, just inform your doctor or call us and we'll get you an appointment set up. If you have any drainage, any dimpling around the nipple area, once again, just give us a call and we'll get you back in, okay?
Okay.
Any problems in that area?
No problem.
Okay. All right. Next, I'm gonna move on to your arms and your hands, okay? All right. Can you stretch your- Okay. Alrighty, so first I'm just gonna be feeling for temperature. It should be cool to warm. Alrighty. Now I'm gonna check your joints for any deformities. Okay. Alrighty, have you been having any problems?
Nope.
Alrighty. I'm checking your wrist. Okay, I'm gonna check your capillary refill. Less than 3 seconds. Okay, I'm gonna check for skin turgor, signs of dehydration. Alrighty. So I'm gonna check your radial and your brachial pulse. Okay. Now I'm gonna have you do some range of motion exercises for me. Okay, can you spread out your fingers and wiggle? Alrighty, can you do feature near a digit? Can you place your fingers together? I'm gonna check for signs of clubbing, making sure there's no signs of respiratory issues. Alrighty. Can you put your arms straight? To the side, up, behind your head, and behind. Any problems with that?
No.
Okay, you can relax. Alrighty. So now I'm gonna check your reflexes. Okay. Can you put your arms out like this? You can relax. Alrighty. So next we're gonna, I'm gonna have you lay down and we're gonna check your abdomen, okay?
Okay.
Can you lay down?
No.
My hands may be cold. I do
Yeah.
apologize.
Okay.
I want to lift up your shirt.
Okay.
So I'm going to basically make sure, look at the contour, make sure he's not using any accessory muscles for breathing. Make sure there's no masses or hernia present. And I'm going to listen. In the 4 quadrants for hypo or hyperactive vowel sounds. Now I'm going to feel for your aortic, renal, iliac, and femoral arteries, okay? I'm going to listen. Alright, now I'm gonna percuss over your abdomen. And the dominant sound should be timpani, and dome is omobartings. Sorry.
Sorry.
I'm gonna try to warm up. Alrighty. Now I'm gonna check for your liver and spleen, okay?
Okay.
I'm gonna do a deep palpation for the liver and spleen, and then we'll go to a light palpation, okay?
Alright.
So are my hands still cold? Sorry. Alright. I'm gonna palpate first lightly. Any pain?
No pain.
Now I'm gonna tuck underneath to feel for your liver. Normally not felt, but it should be firm and smooth.
Okay.
Same for the spleen. I'm gonna go underneath. It felt. It will be signs of enlargement, but I don't feel anything. All right, now I'm gonna check for the kidneys. Any pain?
No pain.
I'm not gonna do an assessment over the genital area, but having any discharge, any.
You can. I'm just kidding. Yeah, no discharge.
Okay. Any burning with urination?
No.
Any odd smell?
No.
Okay. Any swollen or enlargement of the testicles? Any problems with the scrotum area?
No.
Okay. Alrighty. So now I'll move on to the legs. So we're gonna feel for temperature. Should be cool to warm to touch. Alrighty. I'm gonna feel for edema over any bony prominences. Alright. Now I'm gonna feel for your pedal pulses. So I'll start with the dorsalis pedis. Posterior tibialis. I'm gonna raise your knees on that one. For the popliteal. Nice. Okay. Alright, can you come back to a sitting position for me? Now I'm gonna check your reflexes and your capillary refill, okay?
Alright.
Capillary refill. Should be less than 3 seconds. I see you have necrosis of the toenails. Can you kind of give me a background of why? Or?
Just because I run a lot, and so it just happens when I guess you run a lot.
Okay. Any pain in your toes?
No pain.
Okay. Alrighty. So now I'm going to check your reflexes, okay? Feel for this one spot. See, you have a scar on your knee.
Yeah.
An injury or
It's surgery.
surgery?
Yeah.
Okay. Alright. So now I'm going to do some muscle strength exercises. So first I want you to place my hand on your face and just press against. Same. Press against. I'm going to put my arms on your shoulders. I want you to press up as I press down. Okay. Put your arms out like this. I'm going to press down, you press up. Okay. Grab my hands. Okay. Pull towards you. Okay. And push. Okay. And pull towards the bed. Pull towards the bed. Push up. Push up. Push up. Push down. Push up. Push down. Alrighty. So now I'm going to do some sensation and tell me if it's painful or dull, okay, sharp or dull. So I want you to close your eyes.
Nothing. Sharp.
Okay. Keep your eyes closed.
Dull. Sharp.
Sorry.
That's alright. Dull. Sharp. Dull.
Keep your eyes closed. And just tell me once again if it's if you feel, tell me where you feel in your face. Where'd you feel?
Right cheek. Forehead. My right chin. That's it. Right forehead.
Alrighty. Now I'm gonna have you stand up. And I'm gonna just have you walk across the room so I can check your just gait and posture.
Okay.
Just walk straight. Okay, you can come back. Alrighty. And turn. Okay. I'm gonna have you bend over so I can check your spine. Just touch your toes.
Huh?
You can touch your toes.
Yeah.
That's as far as you can bend over.
Oh.
Okay, spine is aligned. Any problems with bending?
No.
Okay, you can come back up. Alrighty, you can have a seat. Alrighty, and this concludes our assessment. Do you have any questions?
No. That was awesome.
Thank you so much, Mr.
Yeah.
Hoffman.
Very good.
Alrighty.
Alright.